Hello, and welcome to everyone who has joined us for today's Institute for Molecular Science and Engineering's webinar. You see the titles on your screen, Enhancing Health and Wellbeing in Cities. We have a privilege to have today with us Dr. Stanislava Boskovic from the Department of Civil and Environmental Engineering here at Imperial. So it is a slightly different perspective on the health aspects, and you will hear from Stanislava how we look at that from the engineering and planning perspectives. This is the webinar as part of the Water Sanitation Hygiene for Preventing Infectious Diseases webinar series. My name is Dr. Anna Mić. I'm a reader in Water Systems Integration in the Department of Civil and Environmental Engineering, and I'm also director of the Center for Systems Engineering and Innovation. So from the perspective of the Institute, we have Leah with us in the background, and she will be putting some helpful links for all of those who attend the webinar, which cover different elements such as Eventbrite page for all the upcoming webinars, links to our YouTube channel, the blog, podcast, link to previous briefing papers, and then also for anyone who wants to hear more about the initiatives, there is also opportunity to sign for the newsletter. Just to do a bit of housekeeping, I guess everyone is already very well familiar with these online events, but just to make sure for all of those who are attending, if you can keep your microphones on mute and video switched off during the presentation. We will be taking questions at the end, so Stanislava will talk for about 40 minutes or so, and then we'll have a good 10-15 minutes for taking questions. So if you have a question for Stanislava, please put it in the Q&A function. And then if there are any technical difficulties, then please use the chat. You will see the IMSE Imperial as an option for the chat, and send the message. Leah and her team will be able to help you. So without any further ado, I just want to say a few words about Stanislava, just to introduce her to you. So Stanislava joined the Department of Civil and Environmental Engineering here at Imperial 4 years ago, so in 2017, first as a visiting academic and now as the research associate on the project she will be talking about. But she has previously lectured in contemporary cities design and urban transformation at the universities in Switzerland and Italy and Russia, as well as in Spain. So she's currently working on 2 projects. So you will hear about projects with a very nice name. So one is called HEART, and then one is called euPOLIS, which are all both EU-funded projects. Which are focused on something that is very relevant for the topic of today's of these seminars, is the improvement of the public health and well-being in the cities through systemic implementation of nature-based solutions. Stanislava is also working very closely with me as the part of the Center for Systems Engineering and Innovation and our small research group on the water systems integration. It's a really privilege for us to have someone like her in our predominantly engineering group, because Stanislava has a doctorate in architecture. So from the Academia di Architettura in Mendrisio, so Stanislava probably said it completely not properly, but from Switzerland, and also first degree in architecture from the Moscow Architectural Institute. I think that final thing maybe to mention about Stanislava and her background is that she has a very interesting background in combination of the academic experience, but also practical experience in architectural and planning projects. And now she is bringing all that together to tell us how we can improve the health in our cities from an urban planning perspective. So Stanislava, thank you so much for agreeing to do this seminar, and over to you.
Thank you very much, Anna, for this very, very kind introduction, and thank you to the Institute for Molecular Science and Engineering for the kind invitation. personally, I couldn't imagine better way to celebrate International Women's Day than to speak about this subject, which is enhancing health and well-being in cities. So the relation between health and well-being and the city from the perspective of planning and engineering has always been very tight. And I would like to start with the very important project for Ideal City, produced around 1486 by Leonardo da Vinci, just because of the very severe pestilence that killed half of the population of Milan. And Leonardo da Vinci took all his knowledge, combining architecture, planning, engineering, and also many other disciplines he dominated, to try to make a project that would improve infrastructure and create clean urban spaces. And more than that, his proposal gave us a picture of a multi-level city, very advanced for those times, with some rules that are still now very, very topical in many of the cities we know. So the rules as the street width to be to match average height of houses, so that the sunlight can always access the housing. So these projects and many others that were created through the some outbreaks like cholera in London in early 19th century influenced the improvements in sanitation, then tuberculosis eruptions in New York in early 20th century also improved the housing regulations and public transportation. All this project, although seen completely from the planning and engineeristic point of view, but they were driven by public health and well-being. Here, I wanted also to draw your attention to another very important not only book, but very important direction for someone who is interested, as our research group is, in health and well-being. It is the work Hygiene, A City of Health, by Benjamin Richardson, who was not planner or engineer, but he did a very precise description of how he thinks the city of health should look. So he gave a dimensional characteristics, and the population of the city was very well defined. He also talked in his work about distribution, the safety of population, and the equal distribution of population between houses. Of course, about the very, very important urban element as accessibility, talking about 3 wide main streets of boulevards, and also the division of different transports in a way to maintain the clean air and any kind of disturb that could be for life of citizens, and always guaranteeing ventilation and the housings full with sunlight. Architect, but dedicated a lot of attention about the combination between the beauty, the composition, and the healthiness of the city, and talk about also some very technical details like materials, levels, and so on. And this was all to take us to the results, all focused on a city of health, where the diseases would find no possible home. I just underlined some of his words just to understand that the focus of this work was to protect the citizens and to find the ideal formula for creating the spaces where would be a very significant decrease of different kind of communicable or non-communicable diseases, and where the mortality would be reduced. So this work and many others were studied over the trying to find an ideal model for how cities should look. And even in the last century, the most prominent examples of cities planning, as the ones of Le Corbusier that you can see on the screen now, were driven by health and hygiene consideration. And these new points of architecture that were described by Le Corbusier in his projects and many works were an attempt towards the integration with nature. So the free grid on the ground floor, in a way that there is always a contact with the vegetation, the horizontal windows, which allow the light to equally be distributed in every part of the city. And generally, the change of the city from the narrow Gothic medieval streets towards a new dimension of block that would enhance the dialogue integration between the nature and the citizens and the residents of the new cities. Well, as Anna mentioned at the beginning, after this brief introduction in relation between the urban planning and the health subject, our group is working on 2 European projects, and the first one is HEART, which is Healthier Cities Through Blue-Green Regenerative Technologies. So we are working in this project. We have just started, and I will just make a brief introduction, and hopefully in some other occasion we can speak more about the results or the progress of the project. But here I just wanted to give you a picture about the group of specialists that are involved from many countries and many different disciplines, including the experts on health, social sciences experts, but also urban planning experts, to tackle the questions about the internal, external temperature in cities and buildings, about the solar radiation, energy consumption, water interface, biodiversity, and other elements that have direct and indirect influence and impact on our health. This is the project that will use not only the knowledge of experts that are involved, but will have also a very strong presence of different stakeholders that are involved on municipality levels or governmental levels of the cities that will be studied, but also from the citizens and all other interested in improving health and well-being and improving actually the tools, the health-centered tools that are focused to improve the spaces where we are living. And if the modern medicine has placed the patient at the center of the health system, well, this project HEART also wants to put the health system in the center of planning decisions and planning processes that have to be performed to improve the impact on the public health, on citizens' emotional state, and also socializing possibilities, and generally improving the process of planning for achieving the results that have a benefit linked with the public health and well-being of the citizens. And now I will focus on another European project called euPOLIS, from the Greek language, which means the city, polis, and you, the health and well-being or the pleasance. So this is the euPOLIS project. And that is 4 years project, and we are now in the second year of project. So the introductory and the initial part of the project has been already started. And this project also introduces an integrated urban planning methodology through the implementation of nature-based solutions in public spaces. So in this project, we will have the implementation, the concrete interventions that are now in the phase of definition, and will test and hopefully approve the results that we are aiming to in 4 European cities: Belgrade in Serbia, Graz Saxe in Denmark, Łódź in Poland, and Piraeus in Greece. So those are 4 cities where the new approach, planning approach, and also new technologies will be implemented. But we, among the partners of this international project, also have follower cities in Palermo in Italy, Limassol, Cyprus, Trebinje in Bosnia and Herzegovina, Bogota in Colombia, and Fengxi New City in China, which will follow, as their name says, all the processes of planning or of analyzing the specific demo sites, and also of the implementation of the specific interventions with the technologies that are adapted for this specific place. And we hope that being participants in euPOLIS project, these cities will also create the conditions for implementing in other projects or implementing in other ways. Also, they further interventions that are focused on improvement of public health and well-being. And besides the cities that I listed, we also have several academic partners on this project. One of those is Imperial College, and our colleagues from this section. And academic partners are focused on the research part of the project, but we also have professional support for all cities, so-called supporting partners, which are planning authorities, engineers, and other experts that are supporting cities in this process of analyzing and then further implementing the projects. We also have a category of partners that are so-called technology provider partners that are in charge with providing the technologies that are linked with nature-based solutions and blue-green vision, but also with monitoring of the baseline status and hopefully monitoring the positive impact and the progress of the project. So as Anna in the introductory part mentioned, this is the very planning and engineering perspective of the project, but definitely in of the approach to health, but definitely in synergy with health-centered approach and significant environmental and, as a consequence, economic benefits of blue-green solutions that will be tailored for specific local climate and social conditions. And effectively, the project aims to regenerate the urban ecosystems around the demo sites. And I will show you and somehow guide you through all our cities to create these urban spaces that are not only inclusive, but also address key challenges that are so topical now with low environmental quality, low biodiversity, and water-stressed resources. So euPOLIS' main objective is to improve the urban resilience to climate change and to unpredictable also events through intervention based on integrated systemic design and modeling for assessment of nature-based infrastructure. This is the scheme of possible MBS interventions in different sites, with the main characteristics of these interventions to be multifunctional, to try not to focus only on one aspect of the problematic or of the function of the problem that we have to solve in a specific demo site, but to create an integrated approach and combine every possible intervention or function of a nature-based solution with another in a way to have maximum benefit of it. So there are different interventions, and I will list just a couple of them that are already linked with specific demo sites or are also applied in several of them. And the first one is the multifunctional pocket park that is tackling the reduction of stress, depression, anxiety level, and also the reduction of number of risk factors for non-communicable diseases such as obesity, depression, and stress. And these parks are meant to encourage outdoor activities and to foster socialization. Then we have waterway with mini biotope nodes for enhancement of biodiversity, which is directly linked with an environment and the groundwater, aquifer or purified surface runoff, but also this kind of interventions have a very positive emotional effect on attachment to the neighborhood. So this is another of the MBSs proposed in the project, and we have partners from Denmark that are focusing their activity on creating and developing those kind of ponds and the effects that have a positive emotional and positive effects on biodiversity. Then we have the nature-based solution for surface runoff quality to guarantee it or to improve it. And you will see we have cities that are very linked with big water surfaces. So this is very important MBS for our project, and also for pluvial flood management in having a goal to reduce risk of surface water pollution, and as a consequence is the risk of communicable diseases. Groundwater abstraction for water, energy, greenery, nexus, again reducing risk of communicable diseases, and shortcutting of pollution of the potable water. Of course, air pollution is a very topical issue in many of cities that we are analyzing now and studying a list of interventions for them in our demo site. So these MBSs and the combination of trees, vertical green curtains are meant to reduce the risk of non-communicable diseases levels and improve the noise condition and generally positive impact, having a positive impact on public health of all vulnerable groups, children, elderly, and disabled persons. There are also technological elements that are helping to create a new elements such as green bus stops and to improve and introduce more typologies of MBS enhanced public spaces, in that sense to increase the number of citizens that use outdoor activities and interactions, creating a positive emotional attachment, as we saw before. And then there is a specific and very characteristic for euPOLIS project element, which is metabolic hub with multifunctional eco-technology, demonstration and promotion, which means that in some of our demo sites, euPOLIS aim to create, to build eco-educational hub where we could show and demonstrate the technologies that are used with a focus on improvement of health and well-being, but also where the dialogue between the experts involved in the project, but also many others from other projects and other disciplines can be involved. And this Eco-Edu Hub, I will show you already advanced scheme, let's say, of an example of this Eco-Edu Hub in one of our demo sites, where we will integrate with educational notion and also with the demonstration of NBS technologies. We will also include the water treatment facilities and also the spaces for gathering and developing the ecological awareness, necessary hygiene measures, and so on. Additional elements are multifunctional floating islands that could help for river water purification and improve microflora. And of course, the purification of water, as I said, but also reduced the risk of communicable diseases that go through the urban water bodies, and that could be rivers, and in our case, but also lakes or other type of wetlands in the area that we are studying. And we have also demo sites that are on the sea coast. So there are also MBSs that are focused on marine aquatic biotope to improve the quality of the coastal line, and also the spaces connected with the development of nature-based solutions through business activation and promotion of the project and the knowledge and the sharing of the experience. Of course, the multifunctionality of and integration of different MBSs can be described in the best way through the different functions of trees. Apart shade, but also cooling, air purification that we all know, and creating a wind barrier where it is necessary, like in some of our case studies in Poland, for example. Well, the aim of this project is to make these three functions interact with other elements as surface water, groundwater, and in that way result in synergy of benefits, and also very carefully analyze the choice of the three species that are adapted for specific case studies. As we know, there are many positive effects, but also there are some negative effects of trees. So the choice of three species is very important in our cities to avoid pollen emission or to, in that way, to avoid the allergic effects that are very, very perceivable in some of the cases we are working with. To help to monitorize the both baseline, but then also on the further stages of the project, the results or the changes in performance of these spaces after the implementation of blue-green solutions. There are different devices that will be used, from sensors, from remote sensing, but also wearable devices that our partners, technology provider partners will not only choose, but also will help us to all project to define eligibility and recruitment criteria of volunteers, to train customer supports, and to provide proper assistance to the citizens during their participation in the project, where the information about their emotional well-being will be connected, for example, through this Feel the Emotions device. Also, there is euPOLIS by BioAssist platform, which aims to combine an innovative e-health and communication technologies, and to somehow make closer needs of users and health professionals, because well, we all know that the vision could be very different, but here the scope is the same, to improve the health and well-being. In that sense, this health assistance through our partners can create the conditions of improving that understanding and giving a comprehensive support at any time. So it's now a moment to show you our cities and our demo sites in the cities that I mentioned at the beginning of the presentations. And those cities, as you saw from the very first map, are very different, but also complementary in many aspects in terms of specific choices of MBSs. And they are different in size, they are different in their climatic conditions, in their social and traditional historic legacy, and therefore many requirements for specific case studies and demo sites are different, but there are also shared requirements that are from the very first analysis and questionnaires we did were connected with the clear intention for improvement of existing green spaces, the mitigation of direct and indirect urban heat island effect, and also refinement of maintenance system, which very often is the reason for non-functioning well already existing spaces created with nature, but due to the maintenance lacks are not performing as it would be expected. And yes, very briefly, we collected in the first year of our work a lot of information through questionnaires, through support of our partners in sitting, in analyzing in different categories the requirements that are linked with urban development, with environmental issues, with social aspects, with business intentions, and all for enhancing through the prism of health and well-being. And we had classified some of those requirements by mandatory, important, or desirable, where mandatory are those that have direct health impact. And we were able to create a list of requirements. And as I mentioned before, we are now in the phase of definition of the list of intervention in every city of the project, in every frontrunner cities of the project. So the first city I will show you is Belgrade, the capital of Serbia, with a very interesting and important position where two big European rivers are meeting, River Danube and Sava. And Belgrade has, as you can see from these pictures, a very rich presence of blue and green elements. And the task of our project is to achieve even more benefits with the potentials that are present in the city, but also identify some gaps and improve the conditions of river or ponds where this is necessary through the surface water purification, and making already very rich blue-green infrastructure of the city even better and focused on health and well-being. So the first demo site in Belgrade is the Linear Park. Linear Park, which is derelict railway, obsolete and in disuse, which was linked with the river harbor of the city and its industrial past. But now the city aims to transform it in a linear park, and euPOLIS will implement some of its interventions in specific points of this 5 kilometers long park to enhance the benefits of the whole project that the city is developing, that you can see here in this scheme. And then to connect it also with one of the already existing parks, and this is the second demo site in Belgrade, which is Ušće Park, very loved by citizens of Belgrade, with many recreational and also cultural elements of the city, cultural amenities of the city. And it has to be, of course, always updated, and I said improved in some of its points. And this is specific spot of the park that will be studied, monitored with existing elements, and improved with the addition of the eco-educational hub that I was showing you at the initial scheme of MBSs that could host a small-scale examples of nature-based and blue-green solutions, and also the monitoring and data communication equipment. So it's meant to be a real new center for promoting the nexus between the urban planning tools, engineering, innovation, and the health and well-being of citizens. And it is meant to serve as a permanent project's legacy spot during and after for the further communication and hopefully for the upscaling of the project's effects on city, but also national and international level. This eco-educational hub is also thought to have a metabolic hub for the wastewater treatment as a part of the eco-educational hub with innovative technology that goes from the linear system of consumption and waste to a sustainable and regenerative circular model. And this technology has already been developed in many cities, and euPOLIS, who has been working over this subject for many years now, is one of euPOLIS partners, and they will be delivering the technology for continuous cleaning process with the plant in the visible part of the structure, and then with a combination of natural and artificial roots with high density and high efficiency biofilms to surface at the root surface to continuously clean the water. This project is in a very schematic view here for this educational hub, but at the moment there is an open architectural competition among students of architecture supported by the University of Belgrade to give their idea of the concept for the EcoEdu hub, which they are about to conclude their working part on the 11th of March, and then there will be a half of a month or 3 weeks time of evaluation of these works, and one of the most important prizes for the teams of students will be the possibility then to work with the experts of the euPOLIS project and in technology providers to develop further the project and to then be a part of the team of building and maintaining the eco-educational hub. Very briefly, there is a project, the demo site, very small scale, especially in comparison to Belgrade in Glat Saxon, the northern part of Copenhagen metropolitan area, with a very small site with a lack of spaces, communal spaces for cohesion of citizens, only with some private gardens here, and with the problems of flooding. So we've been analyzing the current state, the potential of existing elements, and then also with some works of our students, we were studying how to improve the flooding regulation and what could be the definition of an optimal MBS combination for tackling this issue. And there are different scenarios that could work in that city, and in the next stages of the work we will define what intervention can tackle in the best way that problematics. Here we are in Łódź in Poland, in peripheric, central but with peripheric characteristics of the city, because it's a part of the city that is quite marginalized, and nevertheless there are equipments for these open spaces, they are not used properly, and they just serve as open but not vibrant spaces. So the goal here is to improve the conditions, the microclimatic conditions, because probably one of the reasons is the uncomfort that is due to the very high urban heat island effect. So we are working also with modeling to see what combination and what additional blue-green solutions can really improve the temperature, decrease the temperature, and also improve the quality of air. And the last frontrunner city is the city of Piraeus, with 3 demo sites, one in just the coastal line, very intense and densely populated part of the city. Then there is Canal, Acti di Laveri, and the school. And in Microlimeno, in the coastal line, we have to find the solution together with the municipality on how improve this almost lack of contact between, which is now between the sea and the water and the pedestrian part of the city, because it is occupied by the restaurants that are also very important engine of economy of the city, and we have to find altogether the compromise to maintain this activity, but to improve the conditions in that part of the city. Here in a Canal Acti di Laveri, we are working on improvement of the water quality, which now is considerably lower than expected, and therefore to transform it in a very pleasant and desirable for walk, recreation, and other activities part of the city, but also the possibility to use that water for other functions. And the last demo site in Piraeus is the school, where we also are discussing the possibility of creating maybe smaller but still eco-edu hub through the demonstration of the possibility of MBS solutions for students, and also by introducing some new elements that could be demonstrated, but also that could improve the microclimatic conditions of the city. And then, without entering in details, but just to name that we have also these cities that are following and supporting our work over the project with even more diverse problematics, and their projects will be, or interventions will be, the subject of some other presentation. And just to conclude that what we believe from the very application phase of the project, but even more after this first year and something of work, that the importance of multidisciplinary team is incredibly strong, and the integrated systems approach to the whole subject of health enhancement in cities is crucial. And we need innovative monitoring and modeling to be actually the effective tool that guide us in identifying gaps and achieving most benefits. And just to conclude that our project team will continue working on enhancing public health and well-being through dialogue with all relevant experts over the next 3 years. And this is, in a way, an open invitation for further discussion and collaboration on this subject. Thank you very much for your attention. Thank you.
Thanks, Stanislava. Thank you. I guess we can, well, at least I can do a virtual round of applause. I mean, this is really great presentation and covered a lot of interesting information. So For those who are online, we do have time for a couple of questions. And as I mentioned, if you put them in the Q&A part, then we can discuss it. And there's already one question that was posted during the presentation. And the question is around the effectiveness of the solution. So the question is, in your opinion, what are the 3 most effective ways to enhance well-being in the cities? I guess you have mentioned quite a lot of them in your presentation. So if you would have to choose 3, what would you choose?
Yeah, that's a very good question. And my first intuitive answer would be that it really depends where to implement, because every single intervention can have a very different effect in a specific site. So it would really depend on where. But if we have a hypothetical case, then I would say that, well, the innovative systems for wastewater treatment that we saw during the presentation, something that is really effective and completely changed the mindset of having those installations in spaces that could be visited on everyday basis without having to have them somewhere far away from the urban centers, and combine them for an educational notion, which is, and dissemination of the project's results, is something that is incredibly important. And then of course this notion of choosing a specific trees for specific spaces is something that is not covered in all projects, or in all projects we see realized, and we should be very careful with that, just to guarantee then the well-being also of plants, maintenance issues, and having really the benefits not only on short term but also on long term effects.
Great. Okay. So I have one question, maybe until we see if any other questions will be coming into the Q&A part. You mentioned the monitoring and modeling. So maybe my question is generally about the evidence for the link between the urban planning and health. Do you think we have enough data to support maybe optimal urban design for maximizing health and well-being benefits?
Well, I hope we will have even more at the end of this project. We are just trying to build this bridge between the evidence and the guidelines for the planning decision. And this is something that has, and it of course also depends on the specific case, but it has to be synchronized in terms of time and well, temporal and space effect, because the evidence of some nature-based solution could be immediate, but some others, they need much more time. And therefore, I think modeling is the key already, by having the baseline parameters or indicators that can guide us in having a really good diagnosis of what is happening at the moment. And by simulating the different processes or different interventions, we could really have a possibility of seeing a broader picture of what are the options to continue, and to help in that way to decision makers to have a vision of what is possible, or what effects some of the planning decision could have. And this is something that we really cherish, and we should work more on it, because it could save well, time, money, and improve the solutions.
Great. And then maybe just a final question before we close the seminar, because again, this seminar is hosted by the Institute for Molecular Sciences, and lots of health experts will maybe have a look at this presentation. So maybe from the kind of planning and engineering perspective, how do you see the role of medical experts and how they can work together with engineers to create the cities which really maximize the human health and well-being?
I see it incredibly important, and this is why it's such a privilege also being here today. I think that by listening and learning their vision on what we consider are the benefits of nature-based solution, and also learning what medical experts consider the benefits for health, because maybe our perception is different or is immediate, or is seen with a very particular engineeristic point of view. Well, I believe that precisely on that dialogue, collaboration on a very early stages of the project, so not when everything is already done, but on a very early stages of the project can really help for understanding all the problematics that might have arisen, or that in the group of multidisciplinary experts can be seen more easily, and by analyzing them together, avoid to spend too long a period of time without the precious knowledge that health experts can give us from the very beginning.
Great. I think this is a really good way maybe to close the session. I just want to thank the IMSE for hosting us today. Thanks a lot, Leah and her team. Thanks a lot to the participants. The session has been recorded, so the link will be available in the chat and also put on the YouTube. Thank you all very much. Thank you, Stanislava. Huge round of applause, virtual round of applause. And please join for the next IMSE seminar. Thank you very much and have a nice afternoon.
Thank you. Bye. Bye all. Thank you.